Me now via Zoom for more details on effective breastfeeding is a senior officer of the Lagos State University Teaching Hospital, Lasuth, Dorcas Oladokun. Good to have you join us.
Good afternoon. Thank you for having me.
So, according to the figures we have, we see that exclusive breastfeeding has gone up to 28% in 2018, that's up from 17%, but we have not been able to reach the 50% target. Tell us why you think that we have seen an increase, but we have also not seen, we have not been able to reach the 50%.
Okay, thank you. Why I think there is still a little disparity is because in hospitals, we have to increase how we talk to women about breastfeeding. It has to be included in antenatal health talk to mothers. When all hospitals try to do this, I think we are going to go a long way in telling women about, enlightening them about breastfeeding.
And that's really important because women have to know that this is important for their children. But do you think that what role does the fact that women have to work, also play in this, especially when you do not have, sometimes women get about 3 months of leave and that's it. You have to return to work and then you're trying to balance between the child and the work. So what role does that play in terms of exclusive breastfeeding?
Okay. Mothers can express their breast milk. By doing this, it's going to help them a lot and it's going to save a lot of time. Breast milk can actually stay in room temperature for about 4 to 6 hours. Then it can be refrigerated as well for about 12 hours. So they can express breast milk for their babies and keep it in the refrigerator. This is going to help them to save a lot of time and they are going to be able to achieve their goal in exclusively breastfeeding their babies.
So you don't have to be there at all times to breastfeed. But let's talk about the kind of environment that we have. We've seen in some countries where a woman who is breastfeeding her child is frowned upon. People look at it that why would you be breastfeeding your child in public? Do we have a breastfeeding friendly environment in Nigeria? And what more can we do to ensure that we reach the 50% target by 2025?
Well, breastfeeding, there are ways in which women can go about this. You can, if you feel you can't breastfeed your child publicly, you can actually express the breast milk and you can give your child anywhere you go. Since the breast milk can actually stay in a room temperature within 4 to 6 hours. The only thing is you have to, the way you're going to pack it, you should not expose it to sunlight because of our environment.
Thank you so much for that. Senior Officer of the Lagos State University Teaching Hospital, Lasuth, Dorcas Oladokun.
Thank you.